Hello everyone. Yes, myself Dr. Sanjay Khatri. We are here on Unacademy YouTube channel. Class for you, Imageathon. So attractive name. Yeah, lot of image marathon. Lot of images are there. We will discuss. Yes, some you know, some will be new for you. Some good questions, new format questions. Be there in class. Enjoy the image. Before that, why Unacademy? There are so many platforms, but why an academy? Because it has India's top medical educators. Number one, previously an academy have live classes only, but now live and recorded classes, both. All educator put their best experience in those recorded lessons. Watch this, watch that, enjoy that. 800 plus learning hour content, rarely available on any channel. Dedicated doubt solving session, question bank, learn from any device, printed comprehensive notes, everything is there. So there should not be why an academy, it should be only an academy. Yes, and the success story going on, so many rankers are there. Age your NEET PG or FMG preparation, plus or iconic. These are iconic educators of an academy. You all aware those names. Yes. So why not subscribe now? Crack FMG with FMG Mastery. All the top educators will be there. With their experience, they plan the FMG course. What is good for you? In subsequent given hour, we will take to all the subjects with you, all the educators with the respective subjects, FMG Mastery, and we make you master of that. FMG success story going on. These are the few who given their names first. I received so many messages. Yes, many congratulations to all of you. I pray God your name will be there on the next session. Yes, final booster batch. Target NEET PG. Suppose you have learned from some other platform or you are not confident what to read, what is going on. This is the right time. Give just 1 month to an academy educator. Feel the difference. Questions. 2-year-old child present with facial nevus on the left side. Which of the following will not correct? Good question. You know the situation, but sometime what happen? Sometime I want the correct answer. I want the correct answer. Yes, you are right. This is Sturge Weber syndrome. So what are the features of Sturge Weber syndrome? Facial nevus on the same side. Facial nevus on the same side and glaucoma on the same side. Suppose right side facial nevus, so right eye will have glaucoma. Left side facial nevus, so left side have glaucoma. Opposite side seizure, opposite side paralysis. Left nevus, right seizure. Opposite side seizure, and CT show intracranial calcification, which is known as tram track appearance. Tram track appearance. Now see, where is the facial nevus? On the left side. So yeah, opposite side paralysis, we have right side convulsion. This is true. This is true. Left side glaucoma, left side nevus, same side glaucoma. This is also true. CT show intracranial calcification. This is also true. Facial nevus on the left side. Paralysis has to be on opposite side. Opposite side. So it's not left-sided paralysis. It had to be right-sided paralysis. So question you know, and why I took this image first. When image-based question started now, this was the first image. All grand test, all platform, all exam have Sturge Weber syndrome. Good integrated questions. So yes, left-sided face nevus, left side glaucoma, right side convulsion, right side paralysis. CT show intracranial calcification. I hope I am clear in the your concept. Clear? Clear? Answer this. Answer this. I am waiting for your answer. Oral cavity. Yes. What is this structure? What is this structure? Very good. Very good. Very good. Chandni, Harshita, Arnab, Moti, PR Shiv. Everybody is right. Okay, okay, okay. This is Epstein pearl. Epstein pearl. It is the entrapment of epithelium along the palatal fusion. Epstein pearl. But my question to you, if we scrap Epstein pearl, what material we get? Very good, Atur Rahman. We find keratin in it. Keratin. And you all know Koplik spot present in measles. Mongolian spot present in any normal neonate. In natal teeth associated with Few syndrome. We will do question on natal teeth later on. Then I will tell you name of Few syndrome in which natal teeth present. So yes, this is Epstein pearl. This is the entrapment of epithelium along the palatal line fusion. Entrapment of epithelium along the palatal line fusion. Answer this. Answer. You know sometime, but this the exam. Child can able to make figure A, but not figure B. A is a sign of plus. B is a sign of cross. So child can able to make plus at 4 year and cross at 5 year. So child is able to make figure A but not figure B. What would be the age? Between 4 to 5 years. 4 to 5 years. Answer is D. It's not C. Because child is able to make figure A means child is anyway more than 4 years, but not able to make figure B means child is less than 5 years. So age of the child between 4 to 5 years. Am I clear? Am I clear? Answer this question. What is shown in the pic? What is shown in the pic? Tower of 3 cubes. Now my friend, this is image based question, but it's definitely you should know. No logic sir, ये तो आज रिवाइज नहीं किया. No, there are few things you should remember every time. This is one of them. Child can make tower of 2 cubes at 15 months. Tower of 3 cubes at 18 months. Tower of 6 cube at 24 months. Tower of 9 cube at 36 months. That's all. Yes, Moti, it's 3 block tower, 3 cubes tower. Child can able to make 3 cube tower at 18 months. So answer should be B, yeah. Answer should be B. Interactive in the class. You will fun. You will feel fun to learning those image based question. If you answer, if you think, watch the image. We will discuss. We will discuss the relevant text. That image will remain in your mind for longer time. And this is the purpose of Imageathon. Yes. So am I clear? 2 cube tower 15 month, 3 cube tower 18 month, 6 cube tower 24 month, 9 cube tower 36 month. Answer this question. Read and then answer. Watch the image. Now I am getting variable answer. A and C. A and C. There is the check. Now see. Infant born with malformed forearm. If you read question properly, na, malformed forearm, it's over. What malformed, radius which supposed to be here is absent. Radius should be there, which is absent. And child with absent radius comes with bleeding. First thing we thought, it could be a TAR syndrome. TAR syndrome. T, thrombocytopenia, absent radius syndrome. So child born with absent radius, first test what we will do? We will check the platelets. If you, this is the image based question, na? So answer would be in image, na? So why you are giving importance to develop severe hemorrhagic manifestation? So it may be hemorrhagic disease of newborn, vitamin K deficiency. But before that, infant born with malformed forearm, an image show absent radius. So what it could be? What it could be? TAR syndrome, my friend. Thrombocytopenia, absent radius syndrome. Three beautiful question you will remember. Low platelet, absent radius. They ask you directly, low platelet, absent radius. It's a TAR syndrome, or give you a image. Second, low platelet with eczema. It is Wiskott-Eldridge syndrome. Wiskott-Eldridge syndrome. Low platelets, a child presented with eczema, recurrent infection, thrombocytopenia, Wiskott-Eldridge syndrome. And last one, low platelet with hemangioma, Kasabek-Merritt syndrome. Something you will take from the class. Low platelet with low platelet Kasabek-Merritt syndrome. I feel it's hidden with my image. No problem. Kasabek-Merritt syndrome. Kasabek-Merritt syndrome. Low platelet with hemangioma. Kasabek-Merritt syndrome. MERRIT. Clear? So this picture should be there in your mind. This picture should be there in your mind. Absent radius, malformed forearm. Trust my word. 3-4 time questions are there. Image based or direct on TAR syndrome, Wiskott-Eldridge syndrome. Yeah, simple one. I want answer in 5 seconds. Yes, Anubhav is consumptive coagulopathy. Very good. I want answer in 5 seconds. C, it's Turner syndrome. C, first, second, third, fourth, and fifth. Short fourth finger. Short fourth finger. Why short? Because of short fourth metacarpal. You know this question. You all are intelligent. I know you will thinking what sir is teaching and short fourth metacarpal. It's Turner syndrome. We know this. But I want to teach you something else. Short fourth metacarpal. One is Turner syndrome. Tell me other two causes. Tell me other two causes. You write abbreviation, short form in the comment box. First letter you will write, I will give you the credit. Short fourth metacarpal, Turner syndrome, pseudo hypoparathyroidism, pseudo hypoparathyroidism. I was expecting you will write pseudo hypoparathyroidism and then pseudo hypoparathyroidism. Oh, yes. Short fourth metacarpal. Turner syndrome, you know. Till this much interaction, I know. You are good student. You are good learner. So I will make the question level high little bit. But I want to know more causes of short fourth metacarpal. Pseudo hypoparathyroidism. Pseudo hypoparathyroidism. Yes, Kalaman syndrome. Answer this. This is something for you people. Answer this. Condition associated with PIC shown is good, yeah. Now see, this is left side, this is right side. If we see Liver is on left side. Stomach and spleen or right side. So yes, yes, yes. Bijapur, it is situs inversus. But one more thing, you miss it. Everybody miss it. Heart is also on the right side. Na? Heart is also right side. Dextrocardia. So it is situs inversus totalis. Yes, yes, yes. No, infertility is not in the triad. So, what is the triad of Kartagener syndrome? Good question. Triad is SBI. S for sinusitis. B for bronchiectasis. I for inversus. That is inversus totalis. Infertility. Not in the triad. Bronchiectasis. Yes. Sinusitis, bronchiectasis, I inversus, and it is Kartagener syndrome. One beautiful point I will tell you. See, if child is having dextrocardia, child is having dextrocardia, more than 95% chance child will have some CHD. Child will have some CHD. Dextrocardia, heart is on right side, more than 95% chance child will have some CHD. But yes, yes, if child having dextrocardia plus situs inversus, not only heart on the right side, abdominal situs also invert, 99% heart is. So that's the time. We see 9-month, 10-month-old baby, recurrent sinusitis, bronchiectasis. Where do we do X-ray? Heart on the right side. So then we think sinusitis, situs inversus, bronchiectasis, recurrent infection. It can be Kartagener syndrome. So you people, this diagram, this is Kartagener syndrome. Am I clear? Dennin gene. Athor, very good. Answer. You all identify what is the condition. No marks for that. This is congenital diaphragmatic hernia. Your batch is above this. Those who are attending class, above this. This is diaphragmatic hernia. Why? Because intestinal loops are there in thoracic cavity. So no points to diagnose. What is the diagnosis? It is diaphragmatic hernia. For you, something else. So all are poor prognostic factor associated with pics shown, except this is the intestine which comes in the thoracic cavity. What is the common content of intestine in diaphragmatic hernia? What is the common content? Common content in this sac is colon. Colon is colon. Okay. If diaphragmatic hernia sac contain stomach or liver, it is associated with poor prognostic. Yes, antenatal diagnosis before 24 week, poor prognosis. Associated anomaly, poor prognosis. Lung is to head ratio less than 1, where all intestine is there. So lung will be hypoplastic. So lung is to head ratio less than 1. These three are poor prognostic. Colon in hemithorax is not a poor prognostic. Stomach or liver in hemithorax is a poor prognostic factor. Got it? Got it? Colon in hemithorax is not a poor prognostic factor in diaphragmatic hernia. When intestine herniate into diaphragm through foramen of Bogdalek, it is diaphragmatic hernia. So what part of intestine herniate? It's colon. It's colon. So it's not the poor prognostic. When you find stomach and intestine in diaphragmatic sac, it is the poor prognostic factor. Sir, also tell most common posterolateral foramen of Bok-Delek. Left side Posterolateral foramen of Bogdalek. Happiness? Clear? This. Yes, yes, yes. This is the MCQ. Bag and mask ventilation is contraindicated in diaphragmatic hernia. Clear? No points to diagnose what is the condition. This next level question. Poor prognostic factor. If stomach and liver in the content is the poor prognostic factor. Answer this. Yeah, Shalini. NG tube. It's the first test, first thing to do in a patient of diaphragmatic hernia. That's why I am telling you, you are a wonderful learner. So this is meter dose inhaler. MDI. Used in the treatment of asthma. The purpose of MDI, when you press from here and mouth is there, you should inspire. So it require press and breath coordination. Press and breath coordination. Press and breath coordination. When press, then only you can inhale, which is not possible in a 2-year-old child, 4-year-old child, 8-year-old child. MDI, as per IAP guideline, device of choice when child age is more than 12 year. More than 12 year. MDI, meter dose inhaler. Child is more than 12, but child is less than you. What you will do? 10-year-old child. These are various devices. This is MDI, meter dose inhaler. This is MDI plus spacer. Now, if you press from here, if you press and if mouth is here, you press. No need for press and breath coordination. Drug particle will remain in spacer. And subsequent breath goes into lungs. With subsequent breath, so no need for press and breath coordination. This is the method of choice between 4 to 12 years. But child is smart enough to take this portion in mouth. Okay. Child is not able to take this mouth. Then we connect with MDI, spacer, mask. Put the mask over child face, connect the spacer and press. So mass drug will go like this. Okay, this is the device of choice if child age is more than 4 years. You should remember. Now more clinical questions. If you answer this, they will come to know, examiner will come to know, yes, you know something clinical. You know something clinical. Choices of device for treatment of asthma. Children less than 4 year, MDI, spacer with face mask. Children 4 to 12 year, MDI with spacer. And children more than 12 year, it is MDI. So no problem. These are image based question and we are in Imageathon session. Now answer this question. Namaste, namaste. Hope you all are enjoying the class. Now, in newborn with above ECG, what is the investigation in mother? Just hold on. This ECG. Now, ECG from R to R, number of large square divided by 300 is the heart rate. So this is 1 large square, this is 2, this is 3, this is 4, this is 5, this is 6. So 300 divided by 6, 50. Out. Neonate heart rate 50. Heart rate is 50. first thing what you will think, mother is a known case of SLA. Neonate with heart rate 50. Neonate with heart rate 50 with this ECG. Why I am telling this ECG? This is R, this is R, this is R, this is R. Then you find this is P, this is P, this is P, this is P, 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 P. More P than R. It is complete heart block. A neonate, complete heart block, heart rate 50, born. First thing you will do, quickly send the mother sample for anti-Rho and anti-La antibody. Anti-Rho and anti-La antibody. Neonate heart rate 50 with complete heart block, send mother blood for anti-Rho, SSA, SSB, anti-Rho and La antibody. This is the investigation of choice if you saw this ECG in a neonate. Definitely treatment is pacemaker, but first you prove the etiology. What is the etiology? If you complete heart block, more than 75% time you get this antibody positive in mother. Answer this. Again, simple image. Not all images are tough. You are very easy. But this give you a practice whether you need to concentrate on blue vessel, IVC, aorta, what, and you will be confused. What this? Subabnormality here? Or subabnormality here? Or subabnormality here? Then suddenly you come to know nothing, no abnormality. This is your perception. Then you will say, oh, this is horseshoe kidney, which is present in Turner syndrome. Oh, the person who answer B or A. Oh, this is Turner syndrome. Most common renal defect in a patient of Turner syndrome, horseshoe kidney. Horseshoe kidney. Am I clear? Am I clear? This is horseshoe kidney. Answer this. Answer. Now, child able to sit at 8 months and able to walk at 12 months. Sit and walk, between them 2 stages there, in which child move on the floor but not able to stand. Move on the floor. First word is crawling. Second word is creeping. Now understand. Listen. Child move on the floor and front is touches the floor. This is crawling. If front is above the floor, this is creeping. So your chest is above the floor. If chest touches the floor and child move, this is crawling. This is creeping. So crawling come at 9 months, creeping come at 10 months. Sometimes you confused. So just remember this basic thing. What is the spelling of crawling? C-R-A. And what is the spelling of creeping? C-R-E. A comes first. A comes first. So crawling at 9 months, creeping at 10 months. Child able to sit without support, 8 months. Crawling, 9 months. Creeping, 10 months. Walk with support, 11. Walk independent, 12 months. These milestones you should always remember. So Suppose the examiner asks you when child able to creep, you can answer 10. But this is the beauty of image based question. Examiner want to identify first you what is this milestone. So this is milestone. Child move on the floor where chest is above the floor. Creeping, creeping, and creeping milestone achieved by 10 month of age. By 10 month of age. Am I clear? Clear? Answer this. See this picture. Spend just 15 seconds, 20 seconds. Finding shown in pic of neonate is associated with which syndrome? First thing you will wondering, what is the finding? Something wrong in the nose or something nose in the oral cavity, or eyes are not seen, cheek having some rashes. What is wrong? What is wrong? Yes, 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 yes. You are getting it right. See, this is the wrong. It's a neonate. And why neonate will have teeth? Natal teeth. Why neonate will have teeth? It is natal teeth. Neonate born with natal teeth. This was the question. If you are doing good in exam in MBBS or MD, examiner will ask you, neonate born and you find teeth is there. Which syndrome you are suspecting? That will be Ellis Van Creveld syndrome. Not all questions should be easy, na? Short force metacarpal, MDI, this Ellis Van Creveld syndrome. Neonatal teeth, natal teeth, teeth in a neonate, Ellis Van Creveld syndrome. Ellis Van Creveld syndrome. Another will be Pierre Robin syndrome. Pierre Robin syndrome. Yes, yes, very good, Mayank. Yeah, Pierre Robin syndrome. Good. Natal teeth. So image based question. First, you identify the image. What is wrong in image? The teeth is wrong in image. Then think about something else. Ellis Van Creveld, Pierre Robin syndromes. These two you will remember. I will not going in the detail. 3, 4 more are there in rare, but just these two always remember. Ellis Van Creveld syndrome, Pierre Robin syndrome. Answer this question. Little tricky. Little tricky. Radial pulse trace shown in pic suggestive of. This is the beauty. First you identify the pulse, then you identify this pulse is present in which condition. This is the beauty of image based question. I will wait for 30 seconds. Put on your answer. Okay, okay, see, this is the pulse trace. Any pulse is having trace like this. So top represent systolic BP, bottom represent diastolic BP. So what is systolic BP here? 120. What is diastolic BP here? So 40 is here, maybe less than 40, 30. So 120 by 30. So it is wide pulse pressure. Wide pulse pressure. Wide pulse pressure. Wide pulse pressure present in severe aortic regurgitation. Severe aortic regurgitation. So beautiful question. Pulse trace is given to you. You need to identify systolic and diastolic BP. So 120 by 30, wide pulse pressure. What is pulse pressure? Systolic BP minus diastolic BP. So pulse pressure is 90, which is present in severe aortic regurgitation. Severe aortic regurgitation. No, it's not anacrotic pulse. Anacrotic pulse present in which? Anacrotic notch present, which is present in aortic stenosis. Slow rising pulse. Severe aortic regurgitation. Pulse which having wide pulse pressure known as water hammer pulse. Water hammer pulse. It's not anacrotic pulse. Anacrotic pulse present in aortic stenosis, and wide pulse pressure, water hammer pulse present in severe aortic regurgitation. Okay, okay. Answer this. Again, image based question. Typical, yes, also seen in pregnancy. All cardiac output state, anemia, beriberi, pregnancy, thyrotoxicosis. You have a wide pulse pressure. So what anomaly? Something wrong in ear, something wrong in eyes, something wrong in skull. No, something wrong in umbilicus. No, this is image based question. This is image based question. So what is wrong here? No radius. Radius is not there. Forearm is malformed. When radius absent and associated with ASD. Yes, yes, yes. Shimshu. Simhu is very right. It is Holt-Oram syndrome. Child born with absent radius. First test you will do, we will do a platelet check. Second test, we do a echo. If absent radius with ASD, absent radius with ASD, it is Holt-Oram syndrome. It is Holt-Oram syndrome. Am I clear? So remember, this is the image based question, because if you pick the image clearly, then you are able to answer. Diagnosis, put in the comment box. Diagnosis. Platelet for what? TAR syndrome, na? Absent radius with thrombocytopenia. TAR syndrome. No, TAR syndrome and Holt-Oram syndrome is a different entity. A child born with absent radius, it may be isolated finding, or it may be TAR syndrome, or it may be Holt-Oram syndrome, like that. No, no, no. Who put this answer VT? It's very clear. It's written narrow QRS complex tachycardia. See, this is R and R. One large square between RR. So 300 by 1. Heart rate is 300. So heart rate in a child, if it is more than 240, until unless prove otherwise, it has to be SVT. Supraventricular tachycardia, which is narrow QRS complex tachycardia. Narrow QRS complex. VT is broad QRS complex. Here you can see na, normally QRS is like this. But here you can see just a narrow strip. So narrow QRS complex tachycardia, it is SVT. Paroxysmal supraventricular tachycardia. Okay, this is SVT. Answer these two. What are these two rhythm? Yeah, broad QRS in VT, but narrow QRS complex SVT. Now see here, this is R, this is again R, this is R, this is R, this is R, this is R. So you find this is irregular pulse, irregular pulse. So first picture is suggestive of atrial fibrillation. Atrial fibrillation. Second, yes, you all are right, sawtooth pattern with fixed block. This is atrial flutter. This is atrial flutter. Atrial flutter. Sawtooth appearance. Atrial flutter. Clear? So this is fibrillation. This is flutter. This is SVT. Now, fourth ECG I am showing to you. Classical pediatric ECG. Classical. I expect somebody to answer this question. Please, question is coming now. Attentive. Answer this. Diagnosis. First, finding. What are the finding? Second, what is your diagnosis? I want answer. Please. Okay, describe finding first. This is a memorable ECG. Watch this ECG. Keep this ECG in your mind. No, it's not hypothermia. It's not RBB. Okay, I will tell you. See, this first lead you find deep Q wave. AVL you find deep Q wave. V5, V6 you find deep Q wave. This much deep Q wave you can't find in any pediatric ECG. So finding deep Q wave in first AVL, V5, V6. V5, V6. Deep Q wave. Normally what happen in pediatric ECG? You find this is P and this much Q is there. This much. First negative deflection after P is Q. In pediatric ECG you never find deep Q wave. But if deep Q wave is there, who are covering 5 small square, deep Q wave in first AVL, V5, V6. Close your eyes. Deep Q wave, answer. It is ALCAPA. ALCAPA. Yes, Vishwa. I got your answer. MI is right. The same finding is occur in MI in adult. But what is equivalent to MI in adult in children? This is ALCAPA. You will understand. Listen. This is aorta, which gave origin to left and right coronary artery. And this is pulmonary artery. So what happened? What happened? This coronary artery supply right and left myocardium, pure blood, pure blood. This is normal. Now see this diagram. This is aorta, which gave origin to right coronary artery. Now this is pulmonary artery, which gave origin to left coronary artery. Now see, right ventricular is supplied by pure blood, but what happened to left ventricle? What happened to left ventricle? It is supplied by deoxygenated blood because pulmonary artery contain impure blood. So, left ventricular ischemia, myocardial ischemia, MI. What is this? ALCAPA. A, anomalous. LCA, anomalous left coronary artery from pulmonary artery. From pulmonary artery. ALCAPA, anomalous left coronary artery from pulmonary artery. Sign, symptom, ECG, same as that of MI. Why? There is a myocardial ischemia. So what are the classical ECG finding? Deep Q wave in first, deep Q wave in AVL, deep Q wave in V5 and V6. Just remember, ECG shown to you, it's not looking arrhythmia. 2-3 month child age is given. Look for Q wave. Deep Q wave first AVL. Answer ALCAPA. Anomalous left coronary artery from pulmonary artery. Hope you got it. Give me a thumbs up na yaar if you got it. Clear na? ALCAPA. Anomalous left coronary artery from pulmonary artery. Anomalous left coronary artery from pulmonary artery. Left coronary artery from pulmonary artery. Clear? Signs, symptoms, ECG, same as that of MI. MI, chest pain is there. ALCAPA, 2-3 month old child, irritability, increased sweating, refusal to feed. Child is continuously crying. Continuously crying. ALCAPA, irritability, increased sweating. ALCAPA. Remember, this is memorable ECG. You will never find original ECG. I am pediatric cardiologist. I used to see ALCAPA once in a month. Okay, but this ECG for you. ALCAPA. Remember, SVT, flutter, fibrillation, you will got it. But this is ALCAPA ECG. ALCAPA. Anomalous left coronary artery from pulmonary artery. Answer this. Name the sign shown in pic. Steinberg sign present in Marfan. We know this. These are the sign. Muller-Brzezinski sign and Steinberg sign of Marfan syndrome. Bembesky sign is a sign of upper motor neuron lesions. We know. Kerning sign is a sign of meningeal irritation. Brzezinski sign is also a sign of meningeal irritation. Clear? Now see, this is Bembesky sign. If you rub the pin on the plantar aspect, normally flexion occur. If extension occur, Bembesky positive, upper motor neuron lesion. This is Kerning sign. If you flex the hip and then normal position of knee is here, then you try to extend it. Patient with meningitis will not able to do this. Feel pain. This is Kerning sign. But this is if you flex the neck in a patient of meningeal irritation, knee will be flexed automatically. This is Brzezinski sign. Brzezinski sign. Clear? It is not Bembesky. Bembesky is the sign of upper motor neuron lesion. It is Brzezinski sign. Name of the sign shown in pic is Brzezinski sign. Clear na? This is the image base. Once you remember this image na, once you see this image, we will discuss all these points. This will remain in your mind, my friend. This will remain in your mind. Clear? Clear? Answer this. This is baby, newborn, and this is phototherapy machine. So what is the distance? I can keep light here also. I can keep light here also. So what is the ideal distance between light and the baby? Yes, it is 45 centimeter, my friend. Ideal distance between phototherapy light and the baby is 45 centimeter. Is 45 centimeter. Remember this. Remember this. 45 centimeter. Answer this. Classical X-ray. So many time in exam. So many time discussed in pediatric cardiology class or radiology class. The first clue in this X-ray is heart is shifted towards right. Am I right? You are finding heart is slightly towards right. This is the first sign. Heart is slightly towards right. Then see the right. You find some channel is there. Got it? No. Now see. Some channel is there and heart is slightly towards right. This is classical of Scimitar syndrome. Classical of Scimitar syndrome. Scimitar, a Turkish shod. This channel shape Turkish shod. Scimitar. How this possible? It's very simple. Very simple. Just 10 seconds. Normally what happen? Normally what happen? Left pulmonary vein enter into LA, upper and lower, and right pulmonary vein upper and lower enter into LA. Normally this happen. Normally this happen. But what happen in Scimitar? This right sided pulmonary veins, right sided pulmonary vein descend downward and drain into IVC, then into R. So what is this? Partial, anomalous, pulmonary, venous connection. PAPVC. PAPVC, where right-sided pulmonary vein drain into IVC. Drain into IVC. Right-sided pulmonary vein. Right-sided pulmonary vein drain into IVC. That give us the appearance of channel. This channel. This right-sided pulmonary vein drain into IVC, Scimitar syndrome, PAPVC. Clear? Clear? Answer this. Classical question. So many times asked in MBBS and MD quiz. Image based question. Quiz. Neonate present with cleft lip, cleft palate, microcephaly. Finding shown in pic. This is the finding. What is this? Aplasia cutis congenita. Aplasia cutis congenita, or you can call it scalp defect. It is classically present in Patau syndrome. That is trisomy 13. Trisomy 13. Image based question. You can't give this answer with cleft lip, cleft palate, microcephaly. Answer will come only from when we see the image of scalp. Aplasia cutis congenita, scalp defect. It is present. Methamijol, very good. Moti choti, very good. I will come on this. Very good. This is Patau syndrome. Classically, aplasia cutis congenita, holoprosencephaly, microphthalmia, and polydactyly. These four are the classical feature of Patau. Rest are fill in the blanks. Microcephaly, cleft lip, cleft palate, cardiac defect, renal defect, rocker bottom foot. That can be present in Edward. But these four are classical, which will help you to solve the question. So Patau syndrome, aplasia cutis congenita, scalp defect. Answer. Activity shown in pic is done by child earliest at which of the following age? This is jump with two legs. This is known as skipping. When child jump on two legs, this is skipping. My friend, skipping occur at 5 years. 5 years. Answer is 5. D. Skipping. Child can able to jump with two legs 5 year of age, 5 year of age, 5 year of age. Clear? Answer this. First, identify the condition. What is the condition? Hopping at 4 year. Very good, Sapna. Hopping means jump on one leg. Condition shown in pic due to maternal ingestion of which of the following drugs? Yes, it is pyloric stenosis. When we find a child with pyloric stenosis, always ask the mother which drug she taken in pregnancy. Yes, if mother take erythromycin during pregnancy, chance of pyloric stenosis is there in baby. Are you ready? Few drugs, common effect, so many MCQs. If mother take lithium during pregnancy, Epstein anomaly of heart. If mother is having SLE, complete heart block occur in the baby. If mother is having mumps during pregnancy, EMF. Endomyocardial fibroelastosis, glistening myocardium. This is a very good question in the quiz. Child born with endomyocardial fibroelastosis, which infection you suspect in the mother? Mother may have mumps during pregnancy. Yes. Carbimazole, methimazole. Which drug taken by mother during pregnancy leads to aplasia cutis congenita in baby? Carbimazole, methimazole. Antithyroid drug we don't prescribe during pregnancy. And that was the AIMS 2020 June question. Aplasia cutis congenita is a side effect of which drug taken by mother during pregnancy? Carbimazole, methimazole. Our question, erythromycin taken by mother during pregnancy leads to pyloric stenosis. Last year FMG question. Sodium valproate taken by mother during pregnancy leads to neural tube defect in the baby. Yes, I am going little fast because this is the points. Our main concentration on image. Murmur trace present in which of the following? So this is S1, S2, again S1. If murmur is there between S1 and S2, it is known as systolic murmur. Murmur between S2 and S1, it is known as diastolic murmur. Okay, so murmur trace present in which of the following? So VSD murmur is a systolic, AS murmur is a systolic, MR murmur is systolic, MS murmur is diastolic. So this is out. This is not the diastolic murmur. This is systolic murmur. Now, systolic murmur S1, S2, S1, S2. If murmur start at S1, overlap the S2 sound. This is pan-systolic murmur. A murmur start after a gap from S1, ascend and then descend. Ascend and this descend. Ascendo, crescendo, decrescendo murmur. Our murmur is ascending. It's not pan-systolic. This murmur present in aortic stenosis or pulmonary stenosis. So, image-based question. A murmur trace is given. An examiner wants you to answer it. Aortic stenosis. Aortic stenosis. Clear? This is ejection systolic murmur. Ejection systolic murmur. Answer this. Inheritance shown in pic present in classical, all males are affected. All male, all male, all male, all male, all male. So it is Y-linked disease. It is Y-linked disease. And Y-linked disease is, nobody is giving correct answer till date, till now. Moti, right. Webbed toe. Hypertrichosis, hairy pinna, webbed toe are the example of Y-linked disorder. This pedigree show it's a Y-linked disorder. And answer would be webbed toe. Neurofibromatosis is autosomal dominant. Wilson disease is autosomal recessive. Pearson syndrome is mitochondrial inheritance. It's not mitochondrial inheritance. All affected are male. One generation, second generation, third generation. No carrier, no female. All males affected. It is Wilding disease. Classically present in webbed toe, hypertrichosis, hairy pinna. Answer this. Condition shown in figure associated with which of the following condition? This is the things. A echogenic mass in the heart. Echogenic mass in heart. What is this? What is this? It can't be X-linked recessive, my friend, because in their mother should be carrier. Na? All mothers are normal. No mother is carrier. So it can't be X-linked recessive. So yes, most common cardiac tumor in children is rhabdomyoma. Most common cardiac tumor in children is rhabdomyoma. If heart you find this tumor, you always suspect it can be tuberous sclerosis, because tuberous sclerosis 33% patient will have rhabdomyoma. It's not myoma. Myoma is the commonest cardiac tumor in adult. Rhabdomyoma is the most common cardiac tumor in children. Clear? Clear? Answer this. Concentration of sodium. This picture is of ORS. Simple, na? So examiner wants to ask what is the sodium in this. So first you identify this is about ORS. So you can remember sodium, potassium, chloride, citrate and glucose. Sodium 75. Glucose is also 75. Potassium 20, chloride 65, citrate 10 and osmolarity 245. Never forget. Never forget. Never forget. Clear? ORS, sodium is 75. Maneuver shown in pic used in the treatment of what they are doing. Covering the face with ice cold towel. What it will do? See the ECG lead. It means somebody is monitoring ECG. ECG. Okay. ECG and somebody is covering the face with ice cold towel. This is vagal maneuver, which is used in the treatment of supraventricular tachycardia. Yes, supraventricular tachycardia. Answer this. When I was child, in our childhood, we make this cube like this. You also probably make like this. We make two square and join two square and it will be cube. So Om, we will discuss on my telegram. Don't worry, I will help you. Don't worry, Om. Okay, so this cube child can make by 11 year of age. So plus circle cross square, everybody remember the question, this question come in the NEET PG. So I try my level best to give you best of images in Imageathon. Hope you like the class. Hope you like the class. If you like, share with others. Share with your junior, your colleagues in your group so they can also take advantage of this class. I will come with more Imageathon session for you if you like. We will cover in the fun. We will cover so many images. We try to learn pediatrics with images. So keep reading. Let's crack it. Myself, Dr. Sanjay Khatri on YouTube, an academy platform. Thank you. Bye bye. God bless you all. God bless you all. Hope you enjoy the class. Hope you enjoy the class. Thank you.